Hello from Memorytainment. Today's video is about the Creutzfeldt-Jakob disease, an infectious degenerative brain disorder that causes dementia and memory problems. It is classified as a type of transmissible spongiform encephalopathy, and there are three major types in humans: the sporadic CJD, the familial or hereditary CJD, and the acquired or iatrogenic CJD. There is also the type of the new variant, which is observed both in animals and in people. When it appears in cattle, it is called mad cow disease. First, let's examine the history of the disease and get to know its invisible heroes. It was described in 1920 for the first time by the German neurologist Hans-Gerhard Creutzfeldt, and a little later by Alfons Maria Jacob. Creutzfeldt and Jacob first described 5 cases of a sporadically appearing, rapidly developing dementia in patients over 50 years old. This is how the disease got its name, from these two great German scientists. This was the first form of spongiform encephalopathy described in humans. In the decade of 1920, an early description of the familial form was made by the German psychiatrist and neurologist Friedrich Meggentorfer. It was also described between 1928 and 1936 by Gerstmann, Straussler, and Schenker as a deadly familial insomnia. The American neurologist Daniel Gajduszek studied for many years the tribe Fore of the New Guinea, which practiced cannibalism of the dead from family members as a folkway. In 1957, he noticed that the women of the Fore tribe who ate the brain of their dead, by contrast of the men who ate the flesh, presented the fatal disease Kuru, which shall constitute the first form of spongiform encephalopathy with an ambiguous mechanism of transmission in humans. In 1974, the first report of a suspected acquired CJD was published. In 1977, transmission of the disease caused by silver electrodes to the brain of a person with the disease was reported for the first time. The transmission was carried out, although disinfection of the electrodes with ethanol and formaldehyde had been done. In 1980, it was discovered that Dura, a Dura matter transplant product, was proved to transmit the CJD from the donor to the recipient. Until 1985, a series of reporting cases in the United States showed that when it is injected, a human growth hormone of the hypothesis that was infused from a deceased could transmit the CJD to humans. In 1997, Stanley B. Prusiner from the University of California at San Francisco received the Nobel Prize in Physiology and Medicine for the discovery of prions, a new biological value of infection. Moving along, let's check out some important information about this disease. Early symptoms include memory problems, behavioral changes, including anxiety, depression, paranoia, compulsive symptoms, and psychosis. Also, poor movement, sleepiness, intensive hallucinations, and visual disorders are observed. Subsequent symptoms include dementia, unintended movements, blindness, weakness, and coma. About 70% of people die within 1 year from the diagnosis of the disease, mainly from cardiac deficiency and pneumonia. Creutzfeldt-Jakob disease is caused by an infectious agent called prion, a type of small proteins normally located in the tissues of many mammals, cause brain damage by destroying nerve cells and clogging the brain structures. Creutzfeldt-Jakob disease is a type of spongiform encephalopathy. In imaging examinations of the brain, people with Creutzfeldt-Jakob disease seem to have holes in their brain where there are dead cells. This is why the brain looks like a sponge. The fast-growing symptom separates Creutzfeldt-Jakob disease from other causes of dementia. The diagnosis is made with MRI and CAT scan, EEG, spinal tap, and blood examinations. Presently, there is no treatment or effective handling of the disease, but only medicines that help the functionality and the psychology of the patients. According to a systemic review of 2020 on the international epidemiology of Creutzfeldt-Jakob disease, monitoring studies from 2005 show that estimated global impact is 1 to 2 cases per 1 million population per year, and the frequency of occurrence of the CJD is greater in people over 55 years old, with an average age of 67 years. If you want to be part of a wider scope to inform and interact with professionals worldwide regarding matters relating to the challenges of dementia and other related diseases and handling suggestions, just subscribe, click like, and hit the bell to become part of the memorytainment community, a wider community with an excellent purpose.